Every parent wants their baby to be healthy and happy. Babies can't tell us when they feel bad, so it's important to watch for signs that they might be sick. Little babies can get sick quickly, and some symptoms can be signs of serious problems. This guide is here to help you learn about 10 important symptoms that you should not ignore. Knowing these can help you take good care of your baby and get help when needed. Let's make sure you know what to watch for to keep your baby safe. If you find this guide helpful, don't forget to like and subscribe for more useful tips. 1. High fever. When a baby has a high fever, it means their body temperature is higher than normal. For babies, a fever is usually a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher when measured with a thermometer. It's important to know that a high fever can be a sign that your baby's body is fighting an infection like a cold or the flu. Fevers can be scary for parents, but they are common in young children. However, if your baby's fever is very high or lasts for more than a day, it can be dangerous. A high fever can lead to dehydration, where the body doesn't have enough water, and it can also cause seizures, which are sudden, uncontrolled movements of the body. If your baby is less than 3 months old and has any fever, call your doctor right away. For older babies, if the fever reaches 102.2 degrees Fahrenheit, 39 degrees Celsius, or higher, or if your baby seems very sleepy, is crying more than usual, or refuses to eat or drink, it's time to seek medical attention. Always trust your instincts. If something seems wrong, it's better to check with your healthcare provider. 2. Unusual. Crying. Babies cry to tell us they need something, like food, a diaper change, or just some attention. But if a baby cries in a way that is louder, longer, or different from their usual crying, it might be unusual crying. This kind of crying can mean they are in pain or uncomfortable. Sometimes it could be a sign of something serious, like an infection or a tummy problem. If your baby has unusual crying, first try to calm them by rocking gently, offering a pacifier, or singing softly. Check if they need a diaper change or are hungry. If nothing works and the crying goes on, it might be time to call the doctor. It's especially important to seek help if the unusual crying comes with fever, vomiting, or a change in behavior. 3. Breathing difficulties. If a baby has trouble breathing, it might look like they are working hard to breathe, or you might hear wheezing or grunting sounds. Their nostrils might flare, or their skin might suck in around their ribs or neck with each breath. These signs of breathing trouble or respiratory distress can be caused by colds, asthma, or more serious infections like pneumonia. If you see any of these signs, try to keep your baby calm and upright, which can help them breathe easier. However, if your baby's skin turns a bluish color, they are struggling to breathe, or their breathing is very fast and noisy, call for emergency help right away. Quick action is important to make sure your baby gets the right treatment as soon as possible. 4. Dehydration. Dehydration happens when your baby doesn't have enough fluids in their body. This can happen if they are vomiting, have diarrhea, or just aren't drinking enough. Signs of dehydration include a dry mouth, crying without tears, and fewer wet diapers. If your baby's soft spot on the top of their head looks sunken, that's another sign. To prevent dehydration, make sure your baby drinks plenty of fluids like breast milk or formula. If they are sick, keep offering small sips of fluids often. If your baby shows signs of dehydration, or if they haven't had a wet diaper for 6 to 8 hours, call your doctor. They might need special treatment to get better. Remember, keeping your baby hydrated is key, especially when they are sick. 5. Persistent diarrhea or vomiting. Diarrhea or vomiting can make babies lose a lot of fluids and get dehydrated, which can be dangerous. These symptoms might happen if your baby has an infection, a food allergy, or another health problem. If your baby throws up or has diarrhea many times in a day, or if it lasts more than a day, it's important to tell your doctor. To help your baby, offer plenty of fluids to drink, like breast milk or formula, and keep their diaper area clean to prevent a rash. Always wash your hands before feeding your baby to keep germs away. If your baby can't keep fluids down or seems very sleepy and weak, see a doctor right away. Quick treatment can help your baby feel better and prevent more serious problems. 6. Rashes or unusual skin. Marks. Babies can get rashes for many reasons, like heat, allergies, or infections. A rash that's a big worry is one that looks like tiny red spots that don't fade when you press on them, or if the rash is all over the body. These could be signs of serious infections. If your baby has a new rash, it's good to check with your doctor, especially if it comes with a fever or seems to bother your baby. You can take a photo of the rash to show your doctor. Keep your baby comfortable by dressing them in soft, breathable clothes, and avoid using scented lotions or soaps that might irritate the skin. 7. Refusal to feed. Sometimes babies might not want to eat or drink, which can be due to many reasons like feeling sick, having a sore mouth from teething, or not liking a new food. If your baby refuses to feed several times or seems unhappy and tired, it might be a sign they're not feeling well. Offer your baby small, regular meals and check if they are comfortable and in a good position to eat. Sometimes, changing the feeding technique or the type of food might help. If your baby keeps refusing to eat and starts to lose weight or seems very weak, it's important to talk to your doctor to find out what's wrong and get the right help. 8. Unusually pale or blue skin. If your baby's skin looks very pale or has a bluish tint, it might mean their heart or lungs are not working properly and they're not getting enough oxygen. This can be very serious. Conditions like anemia, low iron in the blood, breathing problems, or heart issues can cause these color changes. If you notice your baby's skin is pale or blue, especially around their lips, tongue, or nails, keep them warm and calm, and call your doctor right away. They might need to be checked in a hospital to find out what's wrong and to treat them quickly. 9. Extreme lethargy. Babies need a lot of sleep, but if your baby seems too tired, sleeps more than usual, or is hard to wake up, this might be a sign of extreme lethargy. Lethargy can be caused by infections, not eating enough, or other health problems that need a doctor's attention. Normal sleep means your baby wakes up for feeding and interacts with you when they're not sleeping. If your baby doesn't wake up for meals, or seems weak and less active when they are awake, these could be signs of lethargy. It's important to note how long your baby sleeps and how they act when they are awake. If you see changes in their energy and alertness, talk to your doctor to make sure your baby is healthy and happy. 10. Bulging or sunken fontanelle. The fontanelle is the soft spot on the top of a baby's head. Keeping an eye on this area can tell you a lot about your baby's health. A sunken fontanelle often means your baby is dehydrated, which can happen if they're not getting enough fluids or if they have diarrhea or vomiting. A bulging fontanelle might be a sign of serious issues, like an infection inside the head. Both conditions are serious and need a doctor's care. If you notice any changes in the fontanelle, like it bulging out or sinking in when your baby is sitting up or resting normally, you should get medical help right away. Always be gentle when you touch your baby's fontanelle and look at it regularly to check for any changes. We've talked about serious symptoms like high fever, unusual crying, and breathing issues that shouldn't be ignored. Always trust your instincts as a parent. If something feels wrong with your baby, seek help from a doctor. Keep emergency contacts handy and ensure regular visits to the pediatrician, especially if you notice any unusual symptoms. It's always better to be safe and get professional advice when in doubt. If you found this information helpful, don't forget to like and subscribe for more tips.